Omicron continues to sweep the world. Last week, there were more than 18 million reported cases. In some countries, cases seem to have peaked, which gives hope that the worst of this latest wave is done with, but no country is out of the woods yet. Omicron may be less severe, on average, of course, but the narrative that it is mild disease is misleading, hurts the overall response, and costs more lives.
So I think it's very difficult to say that one country strategy is the right versus the wrong. A country strategy in the face of the virus is based on what the country is experiencing, what the opportunities are for the country. Many countries in Asia took a very aggressive position at the beginning and kept numbers very low. So a zero COVID policy was open to them because they had good control on the virus. I think the zero COVID approach has been, in the main in countries, a focus on suppressing transmission to the absolute maximum, protecting populations with vaccination, having very intensive surveillance, having a very flexible system of public health and social measures, a dynamic, flexible response aimed at keeping COVID transmission to the minimum, aimed at keeping the health system free of severe disease, and using vaccination to fill in the immunologic gaps in the population. If that's a zero COVID policy, it has my full support.
And so it is not the time to give up on the comprehensive strategy that we have outlined, that many countries are using. And as Mike has said, implement them in different ways. But the goals of reducing severe disease and death remain. The goal of reducing transmission remains. And we can do that now.